Hi, welcome to this webinar. It's hosted by JBS International as part of the OJJDP Continuums of Care project. We're so glad you could join us, and I will turn it over to our presenters for the day, Monica Miles-Stevens and Ann Hobbs.
Thanks, Cody. Welcome, everybody. It's great to have you on with us, especially for some of us over the lunch hour. So if you're eating, feel free to eat your lunch. That's no problem. So my name is Monica Miles-Stevens. I am the Assistant Director at the Juvenile Justice Institute at the University of Nebraska at Omaha. And I am one of the members of the JBS Technical Assistance Team. And I'll turn it over to Ann.
Hi there. Good afternoon. Happy Friday. My name is Dr. Ann Hobbs. I'm the director of the Juvenile Justice Institute at the University of Nebraska at Omaha. And we're going to be talking to you today about some really in-depth work we've done in Nebraska and my love of program evaluations and data. So dig in.
Great. Awesome. Yes. Ann is the data person. I'm not the data person. So yeah, we're really excited to talk to you today. Just a little bit, setting the stage for, oh, Amy loves data. Great. Just setting the stage for program evaluation. Some of this might a little bit in the beginning be review for you, but we felt it was important to just cover some foundational pieces. As we've been talking to sites, we've been hearing that we've done asset mapping or we're into our asset mapping, and big questions start to come about, right? In terms of we have all these programs, but how do we know if they're the right programs? Are they serving the right kids? Is there a duplication, right? And so that's some of the things we'll talk about towards the end that we've been grappling with in Nebraska and tried to put a system in place. I know we have at least one person on from Nebraska, so shout out Abby. So feel free to jump in. As we go about, we'll be bringing up some slides here in a minute, but just feel free to put any questions in the chat. There's not a ton of us on today, so also feel free, if you're comfortable, unmuting. Cody's also going to help us watch the chat, so if we miss a question, we want to make sure and jump in. So if you all too could please just, I see a lot of you are doing that, but we'd love to know where you're coming from. So if you have a minute to put your name and your site in the chat, that would be great. We really want this to be able to answer your questions, so please don't hesitate to ask questions as we go along. So I am going to bring up my slides. Sorry, I might have lost them. Just a second, I apologize. Just closing things down and got too excited.
I was going to say, while Monica's pulling those up, just to give you kind of an idea of the format, or we're going to go through some of the terminology up front, but we're going to go pretty quickly through it, just because we don't know like where everybody's at with regard to evidence-based strategies and programming. So we're going to go through that really quickly. So make sure if you're like, hey, slow down or ask questions, because then after that, we really want to dive into an implementation case study, and it'll pick up on all of the prior pieces. So, but just make sure if you want us to slow down, you tell us that.
Great. All right. Okay, hopefully if you cannot see my slides, please let us know, but we'll just jump right in. Really quick, we do want to just cover the vision of OJJDP. I think we've all been to enough OJJDP meetings and things so far under this grant, but just remembering that it's just a really important vision from OJJDP in terms of wanting a country where all children are free from crime and violence, and that our contact with the justice system should be rare. And then OJJDP's mission in terms of how they aim to support and be national leaders and support us in the work that we're doing. So our learning objectives today, are understanding how implementation science guides program design. We'll spend just a few minutes on implementation science, identifying necessary components of good program design, how to use data and information to ensure fidelity to program design, and examining an example of what we've done here in Nebraska to implement a statewide model of using data and information to make program design and adjustments. So let's talk just a minute about understanding the science. What is implementation science? Implementation science is really important as we think about our continuums and thinking about not only just the broader continuum of what we're trying to implement in our communities, but also as you really funnel down into the program level implementation as well. And that's where we're really focused on today. But it really is implementation of science is grounded in medical model. If you think about the evolution of how research and data has informed all the new and emerging medications and treatments and all of those different kinds of things. We interact with implementation science on a daily basis and don't even really think about it. But it's only been in the last probably decade or so that implementation science has made it more into the juvenile justice and the justice space. And I use a lot of and really find a lot of useful information from the Impact Center at the University of North Carolina as it relates to implementation science in our youth serving spaces. But here's just a brief definition in terms of implementation science refers to the methods or techniques used to enhance the adoption, implementation, and sustainability of a program or practice. And I think that's what we're all aiming for, right? As we develop these continuums and aim to figure out what programs are the right programs. It's an ongoing process and a practice in terms of constantly reviewing. And so that's what this little chart is. I'm a visual person, so I love this chart because this is where you're at right now up in the top, right, is planning. We're trying to plan this continuum, gathering data, doing these asset mappings, bringing people together, focus groups, trying to figure out what we want to do, right? As it relates to an actual program, that might be something that comes out of of your strategic plan, right? Is that you need to plan a program. I know a lot of people are really looking at assessment centers, right? So if we decide we want to do an assessment center, then we have to implement it, right? So we do it. We put all the pieces in place and we put that program in place. But then we need to study it and look at the results, right? And that's that program evaluation piece that we're going to talk about today. How do we know that it's working? Because that's the question everybody wants to know, whether we're the ones running the program, consumers of the program, funders of the program, or just a community member, right? We all want to know, and we want to be confident in that what we're putting in place is working and having the right outcomes. And then we need to, from the study, from that data, then we act and we make adjustments. And it's an ongoing cycle, right? So just like your continuum, your planning, your strategic plan will be something that you put in place, but it doesn't hopefully just go on a shelf. And that you do these steps. These are the same steps you do in terms of implementing and evaluating a program. So why does that matter? Why does the implementation science matter? I know in the past, we've maybe all been a part of initiatives where you just kind of decide we're going to do something, you put it out there, and then you just keep doing it for a long, long time. And we don't really stop and go through that cycle. And then we end up maybe not serving the right young people. Maybe we can't seem to keep staff. Maybe we have high burnout, all these different kinds of things. And a lot of that stems from poor implementation. We didn't think through, or we didn't take the time to continue that cycle of analyzing and making adjustments. So when we do that, our outcomes line up with what our intention of the program and the organization are. We have employees who understand their roles. We have employees who understand what they're supposed to be doing every day when they come to work. And it really keeps them engaged in the work that they do when they see those outcomes happen. It helps a leadership align with their teams and their staff. So when everyone's on the same page and we're talking the same language about implementation and outcomes and what our goals are, it really helps with communication and not having that mission drift. Implementation science helps with communication processes. Those are key in order to help with good implementation. We have good budget outcomes, right? Because we're doing things efficiently. We're constantly communicating about things that are and aren't working, and we can make adjustments so that we're having good budget outcomes. And ultimately, it creates good culture and climate. So based on that, we're going to kind of continue on to the purpose of program evaluation. So it's that third step in that graph that we talked about. So why do we conduct program evaluation? We're really striving for figuring out if what we're doing is working, right? There's a lot, Anne's going to talk in a few minutes about evidence-based and evidence-informed practices. I think we all know over the last 10 to 20 years, that has been the core foundation of what everyone wants to see, is that not only do we know what we're doing is working, we want it to be evidence-based. We want it to be grounded in science. And so by doing program evaluation, we're not only serving our own needs in our own programs, knowing that it's working for youth and families, but we're adding to the body of work out there that's showing that certain interventions do or don't work. And it helps us with adjusting and implementing good practices and policy decisions, and helping really translate science into practice. And that's one of the things that is really what we really focus on here at the Institute, is not just doing research and collecting data for data's sake or research sake, but creating and doing things that really help people make sure that their programs can be successful in easy, tangible ways.
The other thing I would add, Monica, is if you don't stop and look at each point of your system and whether it works, it can actually work against you, right? It can feed to pushing kids deeper into the system instead of what's intended. So program evaluation is really important.
Yeah. And that really blends to what's on this slide, right? Not only we need to know what's not working too, right? Whether that's a curriculum, whether that's a process, it's communication between staff or with stakeholders, or a referral process, right? There's always so many moving parts to our programs that when one thing goes askew, it can have a ripple effect to our whole program. And so many times those things are fixable without needing money, right? Usually it's being able to have a new process or a new form of communication, or maybe it's working across town with another organization that's doing a similar program, right? And maybe we're not serving the right target population and we're overlapping. So those kinds of things really help ensure that we're having the outcomes that we want, and hopefully not having to start all new programs or things like that. Program evaluation also supports long-term sustainability and growth of the program, right? So many funders, as we all know, want to see the data. They want to know, what are your outcomes? How are you showing what works? And when we can do that, we can show and grow our program, maybe even replicate in other areas when we can have that data and show that it works. But then also, data isn't just about the numbers, it's about the stories. And so we are going to talk a little bit about different types of program evaluations where you gather both things, because I think we all know some people like numbers, some people like stories. And to really tell the comprehensive story of your program, you need both. But there are always barriers, right, that prevent this kind of program evaluation and those kinds of things. A lot of times we think about research and program evaluation being really expensive. It does take time, right? So sometimes just the extra time that we are asking staff to maybe do an extra form or enter extra data or some of those kinds of things can be sometimes seen as burdensome, and sometimes, in all honesty, are a little bit burdensome. Sometimes there's lack of access to research. So maybe this is brand new, right? Like our efforts and our things are brand new, and that's why it's important to do the program evaluation. No evidence-based program ever started out evidence-based, right? So everybody started somewhere. So sometimes there is a lack of research to explain why we're trying what we're trying. Sometimes the complexity and relevance of the research or perceived irrelevance, it can be complex. It can seem overwhelming, but it doesn't always have to be. It doesn't have to be a really complex research design, especially when we're working with kids. There can be barriers, right, in terms of what we can do in terms of confidentiality and things like that. So we take that very serious. And then sometimes gaps in communication between what the researchers are doing, what the program is doing. So these are all just really important things to think about as we embark on any kind of evaluation of our programs. And I don't know if you'd add anything to that, but I will turn it over to you next.
Absolutely. We'll definitely talk about some of the barriers when we get into the terminology and kind of this case study that we're going to talk about. But I want to spend just a little bit of time setting the stage and having some of the words that we use, kind of using them in a uniform way. And you'll find that this is something the Institute is pretty dedicated to. Like, we've done this across Nebraska. So we're like, let's use the same words the same way. So let's start with evidence-based. A lot of people use this terminology differently. I work with some people in law and psychology, and they are hardcore. Like, evidence-based means 2 randomized control trials, which means, some people are given the treatment and some are not. That's a pretty steep standard for anybody that's doing juvenile justice work, because we just don't feel comfortable giving some kids a program who need it and then not allowing other youth to have that program. So when we use the terminology evidence-based, it becomes really important to talk about what we mean. And so one definition is really just the integration of best available research into the professional practice. And that's kind of one that I gravitate towards. But that wasn't always the case. When we initially started promoting evidence-based strategies and practices and programs in Nebraska, it came from a legislative mandate about 2013, where our lawmakers passed a piece of legislation that said, we want to give additional money to the state, to the various counties, but you have to be evidence-based. And at the time, I was partnering with someone in the psychology field, and we used this very strict definition and found like nobody qualified. It was like 3 programs qualified. So if we set the bar so impossibly high, what it really is discouraging, and we don't really improve the practice. We don't really implement the science. So the following year, we changed our strategy, which we're going to get into in depth a little bit later. But some of the important things to just really be concretely thinking about are, if you want to do something that's been informed by research, knowing a researcher who will pull those research articles. So knowing what's worked in the past, what's effective, what is my desired outcome. That might seem super simplistic, but I'll tell you, I work with hundreds of programs in Nebraska, and I always start with, what's your goal? What are you trying to achieve with the youth you're working with? So it really helps just bring it into focus in black and white, because an outcome can either be a positive or a negative outcome, right? So you could work with youth, let's say through a diversion program, and by bringing them to a class, you're hoping that they will learn something about responsible decision-making, for example. That would be a positive outcome if they learned something and were able to implement it. However, by bringing that youth into a class, they may be introduced to other peers and have negative outcomes. So really being very clear and intentional about, what are my goals for the program? What do I mean by a positive or a negative outcome? How am I going to measure that? And then recidivism is always, in our state at least, it's always something that our lawmakers want to look at. And recidivism, we could have probably an 8-hour seminar on just how to define recidivism, how to measure it. So if you have questions, definitely put them out there. We measure it in Nebraska using a very standardized approach, but it's a term that is problematic unless you uniformly use it across your entire programs, like all of the ones you're going to evaluate. So I want to talk now just a little bit about evidence-based practices or programs versus practices. And I think that's the next slide.
Yeah, there we go.
So, oh, maybe I jumped it. So the difference really between an evidence-based program and a practice is programs are ones that have been technically, they've undergone that rigorous evaluation. In some cases, like I said, some of my peers are like, it has to be 2 randomized control trials. That I don't usually encourage using that high of a standard, but you'll find that some of the model sites use that. You can also now use some scientific methods to imitate or emulate that, emulate a randomized control trial. But I think we're moving into a world where just using some of the best practices are really the first step for programs to implement. And then as you progress down this continuum of being evidence-based, you can eventually do something that's akin to a randomized control trial, depending on the type of program that you run. However, there's lots of programs now that are using evidence-based practices, things like motivational interviewing, or just the practice of using a validated assessment tool. Monica mentioned that many of you are using or thinking about assessment centers. That will be absolutely critical to examine is what's the tool you plan to use at intake? Has it been validated? And what's the intent of that tool? And then from that tool, generally, when you use a risk needs responsivity model, also an evidence-based practice, you're trying to match anything that any assessment outcomes to a referral service. So if a youth comes in and scores very high for mental health needs, clearly we want to then match that youth to that service. So that would be an example of an evidence-based practice. Doesn't necessarily mean that you could designate that assessment center as evidence-based, but they're using a practice that's well established in the literature. So maybe some other terminology just to make sure we have it straight before we fully dive in. Clearly, like you could all go out and read an article tomorrow and be evidence informed, right? Like if you pick up one piece of information from a research study that's been done, that's evidence informed. So it's the same kind of or similar to research based or informed. A promising practice is one that's maybe been evaluated or studied once or twice before, maybe not using that highest standard of randomized control trial, but it's showing good outcomes over time. Effective strategies are also on the continuum. It means generally that programs are doing some positive things, but there's mixed results. So for example, let's say you run a truancy program. You may see that, oh, youth are getting to school more regularly after your intervention. However, maybe that's not statistically significant, or their grades are going down, or they have higher recidivism. So when you get those kind of mixed results, you're in a lower classification, right? Like you're not clearly having the desired outcomes across the board that you want. And then there's programs that are inconclusive. And the first year that the Juvenile Justice Institute evaluated programs in Nebraska, we had a lot of inconclusive programs. And so a program could be inconclusive if they don't collect enough data. Like if we don't know how many youth a program served, or if we don't know whether they attended a mental health session, or whether their grades or their attendance improved. If you don't know information, you can't rate them as even being evidence-based. So you really kind of fall out. And I would say, unfortunately, there's a lot of programs that are inconclusive, that we just haven't taken the time or that we don't have the resources to evaluate. So we'll get to it in a minute. We'll be discussing kind of a statewide model for addressing that exact problem. So I think I'm turning it back to you, Monica, for program design.
Yeah. So now we're going to keep drilling down just a little bit more down in the funnel. So we'd love for you to just share in the chat, when you think of designing a program, what are some of the elements of a good program design that you think are important, that need to be in place as you think about developing a program? Maybe it's a new one, or maybe it's the program you already run. But what are some of those elements of a good program design? And Anne, I might need you to kind of shout those out because I can't see the chat.
Okay. We'll do that. Clear target population.
Right.
Monitoring success. Informed by those who participate.
Great.
outcomes, starting with the end in mind, having a clear data strategy, goals, population and outputs, so kind of the logic model of it, an intervention that's standardized,
Great.
monitoring success. There's a
Well,
lot of great ones.
yeah, I think that we can just turn this webinar over to everyone in this everyone in the audience. That's bad. No, that's great. Those are all exactly what we would say, and these aren't an exhaustive list here on the slide. But we definitely have to think through, right? This is the implementation science of thinking through what that program design needs to be. Because if these elements aren't clear and you don't have consensus with the group of people that are implementing this program, you're going to get off to a rough start, and it's going to make it really hard to evaluate the program. If you're doing, as Anne will show you in a little bit, as we have done in Nebraska, we've kind of grouped like type programs together, so that then we can do a broader evaluation of program types, right? And so by having some of these things in place, like clear goals and objectives, clear target populations, uniform screening and assessment tools, those help you be able to clearly evaluate, because these are your data points. These are the things that you're ensuring that you're meeting as you start diving into seeing if your program works. And one that we need to add that you all mentioned was that voice from the target population, right? How are they informing what needs to be implemented or how it's being implemented? And that's why I love this continuum of care model from OJJDP, because it requires that youth and family voice from the very beginning. What's happening in our community? What's happening to us? How do we weigh in on what the needs are? So that's great.
One thing I would add, and that's one that I'm pretty passionate about, is that it was the first bullet on that was the community needs. Sometimes I see people come back and they're really motivated, like, I'm going to start this kind of program. But they haven't really looked at either the data or listened to the voice of their community to know this is what we really need here. And sometimes it just doesn't line up with our kind of stakeholder thinking, right? Like sometimes we really do need to listen to the community about what they need. So one example that I think of is we had a rural community and how they wanted to spend their community-based aid funds. Their community funds was on a kind of a rec area to just go for kids to go hang out at. And they were really passionate about it. But the funders were like, no, that's not an intervention. But it is. It's absolutely, in a small rural town, it might be the most preventative thing we could do, right? So I just wanted to echo, like, listening to your population and listening to your community is super important. So,
yeah. So for the purposes of today, we're going to assume, right, that we know the why for our program, and that there's consensus that the program will work to address the why. And again, that goes back to the whole reason we're doing this continuum of care plan and looking at the assets and analyzing the data and getting that voice from the community. Right, so that you're in that plan stage, you've decided what to do. So for the purpose of today, thinking about maybe a program that, as you've been doing your asset mapping and your data, that you're starting to emerge to see we have a gap in this area, right? Or maybe you're finding that you have a whole bunch of mentoring programs and maybe there's some duplication, or maybe they're competing for referrals, but there's a gap in mentoring over here. And can we bring everybody together and really plan for having everyone having a key role? So, but knowing that why is one of the first really, really important things. And so this is where, just in that circle that we looked at a little bit ago, where program design fits, right? So we plan what we want to do, and in between planning and doing, we have to design what that looks like, and using all of those elements. So here's some things to think about or considerations as we start doing that program design, right? Is there a model program out there that fits our needs? We want to be able to match the program to the problem using our data, right? And so where do we look for those types of model programs? There's OJJDP, Crime Solutions, SAMHSA, there's lots of research. If you are able to partner with like a university, like Ann said earlier, they are able to kind of do that legwork for you to help you search like what kind of program might be out there. Model programs are programs that have been researched and have been designated as effective. It's really important to think about though, with these model programs, there's some considerations, right? Can you implement these model programs with fidelity? Because sometimes these model programs require specific workforce, they require funding or training. Here in Nebraska, before coming to the Institute, I worked for the Administrative Office of the Courts and Probation. And as we were looking at implementing MST across our state, it really made sense in urban areas where we had enough therapists and volume of youth to be able to fill classes and to be able to meet the really stringent fidelity of MST, right? But out in more rural areas, it just wasn't feasible, right? So that's really something to think about, and something to think about as a community team, right? And partnerships and funding sources. Like Ann said earlier, we have to be really careful about requiring people to do things that just maybe simply can't be done based on geography or other things. With that said, we then got creative, and instead of MST, Boys Town here in Nebraska had already been working on a similar model and trying to get it validated as an evidence-based model. And so we partnered with Boys Town to implement that model in rural areas that didn't require quite the stringent requirements of MST. And that's been really successful. So now almost 80% of the kids across the state on probation have some kind of community-based service similar to MST. So I just jumped ahead to my own slide, right? Can the model be adapted, right? And just be thinking about what are the considerations around adapting a model, making sure that it's legal, that there's still some kind of fidelity to that. Will that have any impact on outcomes, right? Sometimes those model programs are designed that way because there's very intentional outcomes that are trying to be met. If you adapt a model, you need to know you may not get those exact same outcomes. And be able to be okay with that, right? Or that's why bringing on an evaluator to evaluate to see if that's still the outcomes are being successful, because we definitely never want to cause more harm, right? Cost and sustainability are always things to think about. We're implementing any kind of program. How much upfront does it cost? Are we gonna be able to sustain it long term? I know that's something that everyone's grappling with as we look at these continuums of care, right? What can we sustain and how? And what are the workforce needs? And that's a real question right now, right? Especially in some rural areas. I know in Nebraska, we have a significant shortage of behavioral health staff. And so how do we be creative? How do we work together across systems and disciplines to think about being able to implement programs with the resources that we need? We can always develop homegrown programs, right? And I know for a while that's been frowned on because there was such a push to do evidence-based programming. But like I said earlier, none of those programs started evidence-based. They all started somewhere. So there's nothing wrong with starting a program from scratch and trying to determine whether it's going to meet the outcomes that you're trying to achieve. So it can really still be effective as long as you're being informed by research, right? Like using some of those practices like Ann was talking about, using assessments, referral processes, being clear about your target populations, risk need responsivity, all those evidence-based concepts and principles. If you can show how those are woven into your program design, you should still have pretty good outcomes. So Ann, I saw you on mute, so I didn't know if you wanted to jump in.
Yeah, I was just going to add, in fact, if you are so wed to evidence-based programs, sometimes it stifles creativity, especially in our smaller communities where you need to adapt. You need something that will work and is sustainable. So I love the concept, and other researchers have really dug in and promoted some homegrown programs. So don't be afraid to do that or to think creatively. That was all I was going to add.
No, exactly. I think that could be the next innovative thing, right? That will help lots and lots of people. So when we think about just kind of breaking down program design into those different buckets, when we're first thinking about developing a program, we want to think about that target population. Who is it that we're trying to serve? What's the age demographic? Is there a certain neighborhood? Is it probation youth? Is it diversion, right? What is that target population? Being able to identify that is really important later as you are evaluating the program, because if your target population is constantly moving, it's going to be really hard to tell if your outcomes are working. Figuring out what screening and assessment tools you need to use. Now, depending on what part of the continuum you're in, there's different maybe levels of needing screening and assessment. If you're doing a prevention program, you're not maybe going to have as intense of a screening and assessment tool, right? Maybe it's just an intake form. It's gathering some demographic information, those kinds of things that will be able to help you later. Versus if you're in the deeper end of that continuum in probation or in facility based, you're going to be doing more intensive screening and assessment, like for mental health, suicide, those kinds of things. So just knowing and kind of lining up your screening and assessment with what's appropriate and where you're at in the continuum is really important. Having clear goals and objectives, I think some of those in the continuum come from OJJDP, right? Those performance measures, but you still need those clear goals and objectives for your own program. Being able to really clearly identify what activities are happening in your program. As we've worked in Nebraska, we've worked with programs who just said, well, we just do this. And we're like, but how do you do it? And they're like, oh, we've never really thought about how we do it. They've never really written down, like, what are those key activities? Because those are data points for you as you evaluate, and you need to know which of those activities is working, which of those activities isn't helpful. And then dosage, right? Again, depending on where you're at in the continuum, prevention and those kinds of things are what we consider kind of light touch dosage. You just maybe once or twice, it's an event or like a once a week kind of thing, versus when kids are on probation or in the deeper end of the system, we're talking about needing to structure like 70% of their time with activities and therapy and those kinds of things. So again, that's all grounded in the research and the literature that you do as a part of that planning for your program. And then as we're thinking about the monitoring and evaluation phase of your program design, it's really important to figure out what those common data variables are going to be, making sure there's common definitions that everyone understands what we mean when we say intake, what it means when we say, arrest. What are those definitions? That sounds really simple, but as we get into evaluating different programs, we think we're talking the same language and we're really not, especially when we start bringing systems together like crossover youth, right? What an intake means in child welfare is something completely different than what it means in a juvenile justice setting. Making sure that we have clear collection processes for that data. If you can build this in the beginning of your program, it is so helpful to your evaluator later on, rather than having to go back and try to capture surveys or kind of figure out how to pull out data from a system that maybe wasn't designed to collect certain things that are really important. So really being clear up front how you want to collect data for your evaluation. And then clearly defining those outputs and outcomes, right? That logic model that someone mentioned as we asked about those good elements. And quality assurance, right? How are you coming back around and ensuring fidelity to the pieces of this puzzle that you're putting together? And then the final thing, this is a piece of implementation science that we often miss as you're putting together your program. But be thinking about how are you going to tell the story about your program beyond just writing it up in your grant report and submitting it to your funder, or sharing a one-page document at the county board meeting or something like that. Like really think about who needs to know about your program. How do you share that news and that message, right? Who in the community, so that you're gathering those allies and champions for your program, because that's huge for future sustainability. And what other partners can help you carry that message? This is a piece that I think just in human services, we don't do well because we're also focused on helping people that we kind of forget to brag about and tell our story. So really working through that in advance is really important. Okay, so just checking in if there's any questions. Otherwise, Anne's going to dive into the different types of evaluation we can think about for the programs that we put together.
So as we start going into this section, I'd like you to think about and maybe put in the chat, if you had to tomorrow, you had to evaluate one of your programs or something going on in your community, if you could just start to enter those into the chat section so we can kind of be thinking about it. And you'll see why in a minute. What you're evaluating and being very clear about your intent is super important as you approach any kind of evaluation or research. So real quickly, I'm just going to go through like these different levels of evaluation: formative evaluation, process evaluation, and outcome evaluation. And I'll say in the end, all of them are important. It's just where your program is at and what you're evaluating. So for example, formative evaluations really are designed for newer programs. Programs that maybe haven't been in operation for very long. They're really to ensure that that program is feasible, that it's appropriate, that it's doing the intended work. A process evaluation looks at, are your processes working? Like, so let's say, for example, you're running a truancy or an attendance program and you anticipate getting referrals from the school. You might look back and see when you do an implementation study that you're getting those referrals from parents or someone else. So it really describes the process or the steps. And then an outcome evaluation really describes, did you achieve that goal that you set out to when you first designed this program? So we're going to go into these a little bit more in depth before we get to our case study. But the formative evaluation, the first thing I tell programs, and it sounds so simple, but I'm like, what is your goal? And so what we run into sometimes, especially with brand new programs that are funded and with really dedicated people, they're like, oh, okay, I'm going to address truancy, and then I'm going to handle the mental health program or issues that the youth might have because that's causing them not to go to school. And then I'm going to work with the family because they don't have the resources. And then I will, so you already have layers and layers and layers of things. And while that's really admirable, it's really hard for smaller programs to do. Unless you have 3 departments working on those 3 different areas, it's hard to do. So the activities will be difficult, but then also tracking all of that can be difficult. Now, it isn't to say there are some larger agencies that do all of that, but I think being very mindful about what am I really doing with this funding that I have, or this, if you've been charged with doing something. So making sure your program goal is clear. From that, your outcomes should flow from that. So I keep going back to, I'll use a mental health program this time. If you're designing or setting up a brand new mental health program, knowing exactly what you're going to target. Is it just mental health in general? Is it anxiety that kids face in school? So the more you can refine that, the more you can determine whether or not you've hit that goal. And then to know, you need to design some or have some data collection processes or tools in place. So foremost is really having uniform definitions. What do you mean? Is it the DSM-5 diagnosis of anxiety that you're going to use? Because that has implications, right? Then every youth who comes in has to have an assessment to know if they actually qualify for that. So each of these steps requires really intentionality, and then knowing how you're going to use the data. I would say even in the case of Nebraska, we haven't gotten to the point where we're using it quite as regularly as I would like. So being able to have programs look at data at least every 6 months to see, are my processes are working? Am I getting kids in the right way? Are they achieving the goal I set? And then that's really continuous improvement, right? So a formative evaluation is just thinking about these things all well in advance. Process evaluation tells us whether or not the way we envisioned something happening, did it actually get implemented? So let's take the case of, let's say maybe a referral or a mental health program that's in a rural area. Let's say the program designs it or the community designs it that it's rural, so we're going to have the therapist travel to 3 different towns once a week, and they'll meet with youth in the school. When you have that kind of intentionality, then you can see if your process worked. So let's say 6 months down the road, we see that the therapist only went to 2 schools. What that does is it allows you to stop and to check, why is that happening? Maybe the principal said, I don't really want to do this program, or youth weren't being referred. So by knowing what the process is, it allows us to stop and evaluate whether or not that happened. And then finally, looking at outcome results. This is generally for programs that have been around and kind of have some of those processes and their goals are pretty well defined, and determining whether or not they hit them and how to improve, how to have higher results. So for example, in Nebraska, we've had diversion programs around for about at least a decade. Some of them have been around longer than that, maybe 2 decades. So we can see, okay, we now have a good referral source. We know what activities we're doing. We know we're matching the youth's needs or risks to specific activities. And we're really aiming to improve either individual results within the youth or their their future recidivism. So outcomes, as long as you're really clear on what you're trying to achieve through an outcome evaluation, we really can improve programs just by looking at the results. So the example of the diversion program, it allows you to ask some other questions. For example, like when youth fail out of diversion, did that case go back to court, or did the youth not fully complete their diversion program and still go to court? Did they complete it successfully and then have long-term results? We're now able to tell in our state whether or not, like, youth who successfully complete, do they have lower recidivism rates than youth who didn't complete their diversion program? So for a community, it's really important to know those things, because if you put all of these efforts into this intervention and the youth still goes back to court, it actually costs your community more money than if the youth had just gone directly to court. So if you think about it, right, like the program has served them, all of the staff and efforts that went in there. And then if the youth isn't successful and they go to court, all of your court resources are still. So from a cost benefit analysis, it's really costly to have unsuccessful programs. So truancy, the typical outcome that you'd be looking for, or attendance, is, does the attendance improve? And I know this probably sounds super simple, but it actually ends up being really complicated to track because schools count attendance differently. And then mental health outcomes, typically we have to ask the youth or the family directly about the specific issue that they presented with. So did the youth's anxiety reduce by meeting with this therapist, or were they able to handle the conflicts or the school, things that come up in school better by having these meetings with the therapist? So those are just examples of kind of the outcomes that we examine. And I think before we get to evidence-based Nebraska, do you have any questions that you'd like to go through? Or any questions you have? If not, I'm going to slowly just start talking to you about evidence-based Nebraska as like one of my favorite things. So, so please, Monica or Cody, watch the chat box so we know if anything comes up. I see a question about whether the slides will be available. I think that's a Cody question.
Yes, I believe.
Yes, they absolutely will be. They'll be sent out along with a recording of the webinar 1 to 2 weeks after this closes up.
Thanks,
Awesome.
Cody.
So for the next, the remaining time, and we'll try to have plenty of time for questions as well. But I want to really tell you about how this unfolded in our state, because I think research at this level is much more doable than states and programs and funders realize. So the Institute's been around for about 25 years. It wasn't designed to do this specific task. It was actually just a policy body that was designed to be able to answer questions for lawmakers. But around the early 2000s, we started to have this pot of money, kind of like the continuums of care, right? Where lawmakers were pretty insightful back 20 years ago, and they were like, hey, why don't we front load this so we can divert youth out of our formalized systems and give the funding to the counties so they can provide various different services and then therefore hopefully keep youth out of the system. So when in about 2013, 2014, when they started looking at this, the pot of money had been around for a while, but they increased the funds at that time. And so I mentioned earlier, just right out of the gate in 2013, the lawmakers were like, and you shall be evidence-based. And so programs were calling, ringing our phones off the hook because, it's hard to be evidence-based. And where do I find an evidence-based program? And so they had tons of questions. So the first year where we evaluated it, we actually used that highest level and we measured, has this particular model been through 2 randomized control trials? And what we found is really out of 250 programs, only 3 could meet the highest level. So that's really not sustainable for a state that's got lots of rural areas and, not a ton of funding. And so what we proposed the next year is we told lawmakers, we're like, we really do need to keep track of where these funds are going. Because they were proposing like something like $10 million. And we're like, we have some counties that may be using these for road graders. We really didn't know where the funding was going. We didn't know whether they were effective. So we proposed developing a case-wide or a statewide case management system. And it started out really simple. Like we had student programmers at the university program it. So it's not super fancy or anything. So the very next step, I think we can go to the next slide, is we didn't even know what kind of programs we were looking at, right? We would call a program and they would be like, oh, I just do post-prom events. And then we call the next one and they're like, I meet with a kid for, half a year and we work on these kind of things. And as I mentioned earlier, like we would have programs that had like 5 different goals. So we really had to just slow everything down, communicate with each program. And then as we did that, it really became really clear what kind of program by asking the simple question of what is your goal? And kind of limiting programs to like maybe 2 goals, right? Because some goals help feed the end goal. So if I want to reduce anxiety in youth that are going to school, the end goal of that might be that youth have better engagement or their attendance goes up at school. So you can have 2 related goals, but if you have like 5 goals, you're kind of all over the place and it's going to be hard for you to pull that off. So what we did is we classified all of the programs in the state of Nebraska, and we still use this classification to today. And at the end of this, we'll show you the website. You can go out, you can look at it, you can look at the definitions. But some things are really just a one-time event, right? And there's a question about how preventative can that be? So I'll give the example of a post-prom event. If you're going to measure the effectiveness of that, the real goal of that program is probably just keeping kids off the street for that night. So you would want to look at, did any of those kids get a ticket that night? Versus diversion is typically more like a 3 to 6 month long process. And you want to look at, did the youth maybe improve some of their thinking or address the issues that got them into that legal issue that brought them to diversion. Truancy or attendance programs typically aim to achieve better attendance. We have a bunch of prevention and promotion programs in the state of Nebraska, and those are a little bit trickier, even on the continuum that I've seen from OJJDP, right? You could be promoting a particular behavior, like healthy eating is a promotion program, or you could be preventing something like preventing gang involvement. So again, being really clear about what is it that I'm trying to achieve when I work with youth. And then the next one is mentoring. So we went through all of these classifications, and each of them is defined on the Evidence-Based Nebraska website, which you can Google that or we'll show you the website. And feel free, like we had to use uniform definitions. Sorry, Monica, you can go on. So what did we do after we classified the programs? We went out and did that. We did that research, right? We went out and we pulled all of the journal articles we could find, let's say on truancy programs. And we're like, okay, how do you know when a kid's truant? How do we define that? What kind of interventions seem to work with kids who are truant? Um, how long should a kid be in a truancy program? Do kids who are truant show up for truancy programs, right? So we asked all of those questions and then had researchers pull the literature on that. And that is some of that is linked out under our resources on the same website. So you can reach it, go read all of those articles. We have grouped them by that program type. And what that allowed us to do, though, was to pull and to know what variables should we look at. So, for example, I'll use an example of a truancy program that the community was noticing. The school brought to our attention that they noticed 10th graders really is when they started to see attendance problems spike. And they asked us, we looked at the research, we didn't know why. So we pulled, what we did is we put that was one of the variables, what grade is our youth in? And what that allowed us to do was really to look at, first of all, was their anecdotal evidence true? When we collected data over a year's time, is it true that 10th graders skipped more regularly than other groups? And what we found was yes, 10th and 11th grade is really where we saw the spikes, right? And what that does is it allows the school or the intervention to come in right at the end of 9th grade or the beginning of 10th grade and to talk to them about the importance of attendance or to meet with the parents, right? So it really helped target that intervention. So after we'd done the research and we came up with a list of variables, what we did is we created a test system with some programmers at our university at UNO. And then it was literally a test system. We brought it back to the programs, which is part of implementation science. We showed them the screens and we said, do you think you can collect this data? And some of them were like, no, we can't, or we can't get that data from the school, right? So really listening to the constituents and listening to what the obstacles were. In some cases, we use students to go out and help them enter data. I'll tell you how we overcame some of the obstacles to getting data from the school because there's some legal considerations. But we had to really listen closely in order to work through those problems. And then we went ahead and built a system based on their feedback. Like we changed some of the variables, we agreed on terminology, and we trained then, and we train all the time on, programs have turnover and new staff come in and we train them. And I think you can go out and there's still recordings. They're not very good recordings. So don't go out and look at our website. The recordings are being updated. But the other thing where we're really headed and what we encourage programs to do is they can export their data and look at it quarterly. So if they see they're not, kids are just not successfully getting done with their program, that's something they really need to pay attention to. So I'll give you a concrete example of this, and then we'll talk about data security because that's fun. But I was working with a diversion program and we were noticing that they were not enrolling a particular demographic of youth. And it was really like down to a particular zip code. And we thought, this is so weird. We couldn't figure out why, but we had the data. Because we were collecting zip code. And so what we ended up doing is we ended up experimenting and using a different letterhead. And when we sent the letterhead out on a nonprofit agency letterhead, we got a lower response rate than we sent it via the county attorney's office. So really, it allows you to start experimenting and using some kind of creative thinking about how do you get youth to come into your program. So I'll go back now to data security. So when we built the system, first of all, we housed this within our Nebraska Crime Commission because it is collecting information like the youth's name, their date of birth. So this is, tech guys call it PHI, and I'm trying to remember what that stands for, but it's basically identifiable information that you don't want just out on a website, right? So it is housed and has to be behind a secure firewall. Most universities are security now. This is pretty standardized, but back when we did this, like 10 years ago, more than 10 years ago, it was a little bit novel. So agencies had to install a certificate on their computer in order to access it. Things have gotten much easier now, but just be aware that this is data you wouldn't want to put on some kind of shared drive somewhere. So this is in a secure environment. The other obstacles that we had to really give some thought to is we were collecting data that was potentially in violation of the Family Education Rights and Privacy Act, FERPA. So any kind of student data also cannot just be widely shared. And so we worked closely with the U.S. Department of Education and our own state Department of Education. And there's exceptions, right? If you are a program, there's a FERPA exception that allows you to collect this kind of data. So we had school superintendents telling us like, oh, you can't collect this. And there's absolutely, like, the lawyers convened and said, yes, you absolutely can. So if any of you are like super curious or want to know about that, we have a memo that would cite you to the exact place in US code that allows you to do that. And we had similar obstacles with HIPAA because we have some mental health programs, right? So mental health diagnoses and those things, we still have a little bit of pushback from therapists about sharing this data. And I think rightly so, like their intent is to protect the youth and family. So we have worked with them pretty closely to massage the data in such a way that it's like in some cases, we don't collect diagnosis for a youth. We ask the program to describe the overall issue that they're trying to address. So anxiety, for example, but that may not be the youth's formal definition. So I put that out there because I think it's important to, either as the researcher or the program evaluator, like we have to be flexible, right? We have to work with what we have and the obstacles that we have and acknowledge them and sometimes walk around them or don't collect something a certain way. And that's just so we can collect something at all, right? So we can show some progress. So this process of cataloging programs, we didn't know at the time when we started it how absolutely important it would be. But it really kind of lends to this continuum. On this continuum, you can see that promotion comes first. And typically, we see the lowest risk kids are involved in these promotion programs. But prevention, right? You can have a universal prevention program that could be something like just discouraging kids from drinking, say, or vaping, versus selective prevention, which would be if there's a designated like anti-bullying because you have something occurring in the school, or indicated, I think would be more like a gang prevention program. So the more we define programs, what we found is as the researcher, we were defining it and using a set definition and then giving it to the programs and saying, does this match what you're doing? And what we found is programs got better and better and better about clarity of thought, right? Like they were very clear about what they were trying to achieve. Or in some cases, they were like, no, that's not what I do at all. And then we realized, well, we would be trying to measure the wrong thing or capture the wrong thing or holding you to a standard that isn't what you're doing. So again, we have some programs, let's say mental health. I may look at their statement and say, I think you're trying to improve youth's mental health. And when I try to confirm that with them, they'll say, no, I'm working with the family to address, resources issues. So the better you define what you're doing and know the outcomes, the more comprehensive you can evaluate a program. The other thing that it's really allowed us to do is to bring people together in communities of practice. So I'm trying to remember the number. I think we now have something like 67 diversion programs in the state of Nebraska. And so they're kind of all on a listserv. And when we go to conferences, they can come together and talk to each other about things like 1 year UA tests were really expensive all of a sudden. And I think this was around COVID or post-COVID. And so they all brainstormed, like there was this small rural county who'd found this really cool workaround that was working for them. And then as researchers, we came in and said, do you really want to be doing UAs with these low-level kids? So it kind of allows an atmosphere for us to come together, talk research, but also just talk the practicalities of doing their program. One of the first moments that was really eye-opening for us was truancy programs. So when we brought together attendance programs, what we realized really quickly was just in one city alone, they had something like, I think it was like 16 different ways of counting attendance. So that like some of our elementary schools count tardies. Like if you're tardy, so many of those add up to a missing day or missing, and then high schools count class periods as missing. So when we went to count, like we needed a uniform metric to measure, does attendance improve, right? Because we were measuring this across hundreds of schools in Nebraska. So by bringing programs together and starting to use the same terminology and the same outcomes, we had programs either really buy in or say, no, I'm not doing that. I belong in this other group, right? So it's a really useful tool. The literature and the research is also very helpful, and I think it's helped programs. Like we tend to try to dive in, get the research, and then put it into really understandable terms, which you'll see in the matrix that we use in a minute. So I've used a lot of different examples, and I would really encourage if there's any of the people listening, if you really want to have us walk through a different type of example, or if you want us to focus on an assessment center, I'll pause and give you a chance to enter that in or give me feedback. Otherwise, I'm going to use a truancy example. So. I don't think I'm seeing anything in the chat box, so I'll keep moving ahead. So every program that we work with has a uniqueness to it, right? But by looking at things by a group of programs, it allows them to have some uniform metrics, but also then to measure themselves against a program that's on, 8 hours away at another part of the state. And that may seem like, well, do you really want to do that? And it just is a useful measure. So for example, universities do this all the time, right? In ranking. So instead of making it a competitive environment, we've tried to make it a collaborative environment where if my program's showing better outcomes, then I can reach out to Monica's program and say, hey, or Monica might reach out to me and say, what are you doing that's getting kids to enroll? So the kind of things that we collect, the basic process variables for a truancy programs are things like youth referred. What date do they come into the program? And then do they enroll? This may sound silly, but kids who have trouble attending school also have trouble attending an attendance program or a truancy program, right? So we're specifically looking for things like dates because for youth, if a process takes too long, youth have told us point blank, right? They didn't think the school was going to catch up with them because they hadn't reached out to them in 6 months and they'd been missing every day. So paying attention to time is really important for programs. And so sometimes what we see is a program that takes really long to enroll a youth. They'll send a letter out saying, hey, the county attorney said you're absent a lot. They use more formal language than that, but come into our attendance program. And if nobody ever follows up, the youth's like, hey, I got away with it. I'm not doing that. So paying attention to youth referred, whether or not they enroll, is really important. Also, before they start the intervention, before they meet with that program, knowing what percent of the time was I absent? So let's say before I come into Monica's program, I'm absent 50% of the time. Well, hopefully after I meet with Monica, that's going to change, right? So we also look at the different types of truancy because sometimes kids are out because they're ill. Sometimes they're out because their parents taking them on vacation. So we try to also look at kind of a finite detail of why someone's absent, if it is an excused absent. So the goal of this type of program is to improve the youth's attendance. And so we have two different measures. We ask a program to enter, did the youth successfully complete or partially successfully complete or something other? And then also did their attendance improve? And the reason for that is both of those should be aligned, right? If I'm running a good program, typically I'm going to discharge youth whose attendance has improved. But we've actually run some evaluations where we had programs that the attendance declined and they were successfully closing cases. So that gives us an opportunity to pick up the phone and say, what's going on? Is our data collection wrong? Or like, what's this process that's not working? So really all of this brings us to, in Nebraska, when legislators passed this piece of legislation, they didn't want to just know what kind of programs that we're running. They wanted to know, are these programs effective? And that was a question that kept us awake for a lot of nights, because what do you mean by effective, right? Yeah, effective can mean lots of things. So we had to measure it by all the different program types. But then also lawmakers really wanted to know, were these programs effective at keeping the kids from getting deeper into the legal system? So that caused us to look at recidivism. So do youth who do Monica's truancy program, do they eventually end up being filed on for a status offense or a law violation? Do they eventually end up on probation? Or do they eventually end up in a detention center? So we measure all of those different, we capture a lot of the different variables, and then we work with our crime commission, who merges the data and looks at those later system points. So we can now answer those questions like across the state. That might sound really daunting, and it did to me probably 10 years ago too. No, it didn't. It was not a probably, it was definitely, it was very daunting. But working even with a small group, like in a community, if you look at your different points in a, let's say in a county environment, seeing which youth fail out typically allows you to anticipate that next point in the system. So if I look at kids who fail out of diversion, that's the funnel to probation. So it's really a very salient point for continuums of care to pay attention to who's successful in a program and who's getting pushed deeper into the system. So I think we're just about at a point where we can open this up for questions, but I want to show you, in the last year, we've moved to a more in-depth. If you go online, what you're going to see is all of our reports are grouped by a program type. So it'll be like diversion programs, and it'll give you results for different diversion programs across the state of Nebraska. Last year, what we started to do is we started to provide individual level reports for all of the programs. So that's like 293 programs, using these very specific measures that come from the literature. So again, this is an example of our truancy matrix from last year. And so what we know is if you're targeting a population, if you overserve a population, so if I'm looking at program population, we want to know, did the attendance program get the correct population served? So we take our Department of Education data and we can say, let's say in Cherry County, which I always use Cherry County, it's a small county in Nebraska, but let's say 50% of the population is Native American. It's not, but let's say it is. Then in my program, or 50% of the population that's chronically absent, that's what's reported by the Department of Education or Nebraska Department. What I want to see in my program then is I'm serving roughly 50% of Native American youth, right? Because that's the program that's your community need, back to the very beginning of this presentation. So you want to make sure we're addressing the need. Sometimes what we see is it's a miss, right? The program didn't serve any Native American youth, or they're serving all white youth, or they're serving very few youth. So that program population tells you something really important about your process. Who's coming in the door? The next point in the system is just successful cases, which I've talked a little bit about. Like, if a program closes fewer than 40% of their cases successfully, they really have to look at why. It might be a mismatch in the hours their office is open, or it might be a mismatch in expectations. Like maybe they're making kids do 200 hours of community service. So when you see that lower level, that first column that says needs attention, programs really have to pay attention when they're falling into that category. The medium, the promising realm, you'll see it's a really broad window, partially because that's what the research says. There can be multiple studies that say, yeah, sometimes, closing 45% of my cases might be because it was COVID and I couldn't get anybody in the front door. So there's lots of variables that can impact a program being promising. Going on to the next line, the impacts on attendance. Sorry, go back 1 second. The impact on attendance. Occasionally we'll see an attendance program that causes attendance to get worse. That's why that's in the needs attention. Like, that shouldn't happen. But you can see, like, if it's a smaller community and they only serve 5 cases, that might just be an anomaly. But if you see that pattern year after year, that's probably a program that shouldn't be funded, right? Like, we want programs that are going to change and have positive outcomes, not ones that could do further harm. We also, for school-based programs, we measure attachment to school and whether or not a youth reports higher levels of attachment after doing the intervention. Because we could run a program that's so harmful, the youth is less involved in school, right? And then this last line on the bottom, future system involvement, is very clearly driven by our legislature, and we use a very set definition of recidivism across the state of Nebraska. We actually call it future system involvement because some of our kids haven't been involved in the system yet. So at the end of our reports, we include this evaluation, trying to use just a very simple approach. This year is a little bit more complicated, but again, just really trying to inform programs. Like, did you hit that intended population that you were trying to serve? Did you successfully close cases? So you can see in this example, yes, they were hitting their promise, their target population, but they were closing very few cases successfully, fewer than 40%. They didn't collect enough data. So when something's grayed out, it means they didn't collect good enough data on attendance and whether or not that changed significantly over pre and post. And then looking at some of the other outcomes, though, we can see that they were doing something pretty positive. And then future system involvement, we compare kids who were enrolled successfully in the program to kids that were not. And in this case, there wasn't a significant difference between those two populations. So if I do all of this work and it doesn't achieve the outcomes, it's pretty hard to mark a program as effective. In this particular case, we write these up. And if you want, you can go to the next one. We write up a narrative and we describe, so it's not just the boxes. We describe to the program specifically, let's say using the example of Cherry County and my fictitious 50% Native American, we would just specifically say you didn't serve this percent of the population, and it appears that was a need in your community. So allowing the program to really understand if they missed a target or they missed an area, and then talking them through it. We hold webinars and talk to the programs about walking them through each of the points in the system where if something missed. Again, the goal is always to then increase and to change the outcome for that program, to increase their results the next year. And sometimes there's lots of factors that go into things, right? Like something like COVID hits and it totally unravels everything. So I think also being very understanding that, programs can't achieve miracles sometimes, that it's a give and take. And the goal is one baby step after the next to improve. So we always end our reports with recommendations and how to improve and to move forward. So I think I'm seeing Cody's screen, or Cody, did you have something? I think you're unmuted.
That wasn't me.
Oh. And my screen changed. Monica, do you still have the PowerPoint going?
No, I turned it off. I was going to just drop the JJI website in the chat because we have about 10 minutes for questions.
Sweet.
So I just dropped the Evidence-Based Nebraska website in the chat for people if you want to look that up later. But yeah, we can kind of just open it up for questions about anything that you heard that you're curious about. Feel free to unmute or just drop your question in the chat. Don't be shy.
One thing I'll say is if you go to the website, you can use, there's definitions of things, there's a code book. Like if you're starting a program, I would encourage you to see how it compares to yours, right? And I'd love it if you're like, oh, we don't define it this way. I'm always curious. So reach out and be like, we define it this way. I love to hear different ways of doing things. So it'd be really, I'd love to hear from you if you are curious about different definitions.
This is Jenny. I just wanted to add too, because I'm listening to all this and it's so much good information, but sometimes it's like, oh my gosh, where would we even start if we wanted to do this? And so just adding that if this is something you're interested in having additional like training and technical assistance on, we can do that too. This is kind of an introduction to some of these ideas, but it doesn't mean that, you know, you're going to be like, cool, I'm going to go do this today. So we have the resources to provide that with Ian and Monica. So reach out when you get the email, or reach out to your coach and let them know, like, I want to hear more or have more of a discussion about this, and we can arrange that.
Yeah, for sure. Like, this didn't happen in Nebraska overnight, so it's definitely been a work in progress, and we've done different reports and different ways of looking at this. Like, just in the last year and a half, have we really been able to dive in and do these kind of individual type reports like Anne showed at the end. So just know that it's something that takes time and planning to do. So
I love how Jenny said, we're just going to go do this.
I do
Jen,
have
do
a
you have a
question.
question?
So yeah, so thank you so much. This has been it's really nice just to kind of see it structured. You know, we're wanting to support, you know, the grassroots organizations in our most kind of highly vulnerable communities. And so these are oftentimes mom and pop or even just mom like programs. And we're hoping to kind of develop an incubation kind of, you know, support for them where it's everything from grant applications to obviously program evaluation. And do you know of anything that really focuses on those particular populations where it's often, you know, in the community? And if you could you put it in the chat and I'll grab it? Or I see you nodding, so I'm hoping that means.
Yeah, one of the programs that we work with is in Omaha, is a refugee-based program, and it describes the population and the target population. And what surprised us is they were off the charts. They were one of the most successful mentoring programs, and they were lining up against like things like, you know, the big mentoring program names. So I think if they, I don't know if this is possible, but if they can develop, or if they have a researcher they can reach out to, or somebody they can kind of constantly have this communication with, and dig into that website and like figure out what's the goal they're trying to achieve. I think it's totally doable.
Yeah, see, that's kind of the interesting part, is that there has been outreach to, you know, universities, but it's just you know, they can't meet at the times, you know, their schedules. So it was like, how do we start with the basic blocks? Or is there any kind of clear outlines, almost like a workbook for them to go, you know, this is a good way to start with data. And this is a good way to start, just so that they can build. I mean, they're so small that even partnering with like a university is overwhelming for them. So
Yeah, we're working on a toolkit, and I think what Jenny just said is you could partner them with us and we could just have a Zoom call.
yeah, even Zoom calls are tough. Does that make sense? It's like we're probably going to provide like someone to help them navigate that piece, but yeah, you know, technology is not something that many of them are comfortable with. So Zoom calls are not.
Yeah.
That's how grassroots we're talking. So
Yeah.
So.
I think
When
you
the
made a really good point, Jeannie, and it's something that I think a lot of sites grapple with, right? Like, that's the people are wanting to partner with, when we say partner with community, and really, but then how do we help them with that capacity?
Right.
It's a really good question. I don't know that we have the answer, but I think it's one that our team can jump in and grapple with a little bit and see what we can find as well.
Yeah, and Marcy's suggestion about our foundations do it, and they do great with like the mid-level community organizations, but we're talking the itty bitty ones, you know, the ones that are really in the communities, and the kids and the families know those individuals and trust those individuals. That's kind of what we're hoping to get. And I appreciate it. It's kind of like, I think that's the direction we're all going, is how to build that capacity. You know, and that takes time. I realize that.
Yeah, it's interesting because here in Nebraska, the grant funds that we're talking about, that we're evaluating, they're kind of like formula grants. They go to every county based on kind of like a formula population. And then some counties, like our bigger counties, kind of disperse that amongst, they have kind of their own process, right? One of our senators is trying to carve out money from those grant dollars to go specifically to the type of organizations that you're talking about. But that is a concern, right? It's that capacity to be able to handle the grant applications and the reporting and all of
Right.
those.
Yeah, and an RFP, because our county does the same thing, and they cannot navigate an RFP. I mean, they just, it's a lot for them. And so it's almost like micro grants with very limited, and we guarantee the oversight. And so, yeah, if there's ever, yeah, I'm still looking for, someone that's navigated that also so that I don't have to repeat all those steps again. So, but thank you. I appreciate it.
Yeah.
Great question. Thanks for bringing that up. Any other questions? We have maybe time for one more question. Hi, Amy.
I probably have a million questions, so I will take that 8-hour session that Anne mentioned. But I notated something about, when we were talking about promotion, who needs to know about your program, how are you sharing your news and messages? Excuse me. So what have you two found most effective as far as promoting?
I'll jump in with one of my very first experiences was looking at diversion programs in one particular county and what it costs to run that program. And I remember talking to the county board, and they were just like, I think sometimes when you talk to politicians about money, that's the key to that population. So that's something that stands out. Like that was something that was really effective. Getting them to understand why it's important to front load was just giving them the cost. What does it cost to run? At the time, it was 52 cents a day. That's probably way higher now. But then compared to your diversion population or detention, what does it cost if you leave a kid and you don't do any interventions? So that's something that kind of stands out to me. I don't know, Monica, if you have a more recent example.
Yeah, it's about relationships, right? Are you familiar with Frameworks Institute?
I'm not.
I'm looking that up. I'm gonna drop that in the chat. They have really done great work about researching how to frame messaging around different all kinds of different public health, juvenile justice, all kinds of different things. So they have that's a great website to start with. But and they talk a lot about like, depending on who your audience is, right? How to craft your message to different audiences, how to find your champions, right? For, it may not always be you, maybe it's your board member, it's maybe through their connections, just kind of creating that, and some of that, implementation science, in those resources in the slides when you get those. Some of that implementation science, those references have some good information about developing those messages and those communication plans as well.
Well, thank you so much, and I definitely appreciate the links, and I'm still getting my feet wet, but I'm starting the process and feeling more comfortable. So I actually reached out to Abby last week for a little advice, and so it's really great to hear from you guys and get your extensive background and help with everything, especially being a newbie over here.
Well, it's a constant work in progress, right? And that's why it's great to have these kinds of dialogues and be able to learn from each other, because we're still learning new things every day too. So I just saw Marcy's Positive Youth Development Toolkit in the chat. So that's a great resource too. Thank you.
I know, Monica, you've done some work with Denise Hers on positive youth development, right?
Mm-hmm. Yeah.
So programs may use that. I don't know of any, we're not measuring any outcomes on it right now, but individual programs in Nebraska might use it.
All right, well, we've come to the end of our time. So thank you everyone so much for being on. for just listening, participating, sharing your ideas and questions. Like Jenny said, if this is something you're interested in, any kind of follow-up conversations, we're happy to do that. Just reach out to your coach, and we can get something set up. So have a great weekend, and thanks again for being on.